Which supplements actually help with anxiety? Let's talk about 5 supplements that have genuine clinical evidence for anxiety, what they do, how they work in the body, and exactly what to look for when you buy them. Number 1, ashwagandha. Ashwagandha is one of the most well-known adaptogens for anxiety, and most people are taking it completely wrong. Your body has a central stress response system called the HPA axis. Chronic stress and anxiety can affect this system, leading to altered cortisol levels and other long-term consequences. As a result, your nervous system remains on high alert for longer than it should. It's like leaving your HPA axis stuck in the on position. Think of ashwagandha as a dimmer switch for that system, not off, just back to normal. Some large ashwagandha studies have shown significant reductions in stress scores and meaningful drops in cortisol levels within just 60 days. This may be particularly helpful for people over 40 as chronic stress and hormonal shifts further affect cortisol levels. But this applies to anyone running on empty. Studies show that ashwagandha is quite helpful for sleep. Its calming effect makes it beneficial to take it at night. It is important to avoid ashwagandha if you're pregnant or have stomach ulcers. Studies show a significant reduction in stress levels when taken at a dose of 300 milligrams twice daily for 60 days. One important thing to note is that you need to give ashwagandha time to work, at least 4 to 8 weeks. You're not masking a symptom, you're recalibrating a system. But here's the catch. The brand of ashwagandha you choose is extremely important. I'll come back to this in a few minutes. Number 2, Rhodiola rosea. Rhodiola supports dopamine and serotonin signaling and appears to reduce stress-induced fatigue, the mental exhaustion that stems from sustained psychological pressure over months and years. Unlike ashwagandha, Rhodiola works faster. It can produce effects within hours to days, while ashwagandha typically requires weeks of consistent use. Rhodiola is better taken in the morning rather than at night because it can be energizing and stimulating, meaning it has the potential to interfere with your sleep. The advantage of this though is that it is helpful for anxiety accompanied by fatigue and exhaustion. So if you feel anxious and exhausted at the same time, if you feel like your gas tank is on fumes but your engine is still revving, Rhodiola can be very helpful here. Rhodiola has also been used for altitude sickness, improving athletic performance, bladder cancer, depression, fatigue, generalized anxiety disorder, and tuberculosis. There is evidence supporting its efficacy for treating fatigue. The dose for Rhodiola is 100 to 600 milligrams, but it is advisable to take a break every 1 to 2 weeks. Side effects of Rhodiola are not common. When they do occur, they tend to be mild and infrequent. The most common are dizziness and dry mouth. Now, this video is part 1 of a 2-part series. Part 2 covers 5 more supplements that work on different pathways and the anxiety-sleep connection, including one that has been shown to work better than prescription medications. Number 3, holy basil. This is the one most Western psychiatrists have never recommended. I think that's a mistake. Holy basil, also called Tulsi, has been used in Ayurvedic medicine for centuries. Modern research is only now catching up. Holy basil targets cortisol, but is also very helpful for inflammation, just like ashwagandha and rhodiola. Holy basil is used for anxiety, stress, and diabetes. Research suggests it may also help with enhancing memory and improving symptoms in patients with generalized anxiety disorder, GAD. It tends to be well tolerated with minimal side effects, but it has a bitter aftertaste. The recommended dose is about 300 to 2,000 milligrams daily. So what do you look for on the label? Check for a standardized extract with confirmed oxalic acid content. That's the active compound. If it's not listed, the product hasn't been standardized. Now, before I go on to number 4, please note that this video is not medical advice. These are educational insights based on current research. Please work with your own doctor before starting or changing any supplements. Number 4, L-theanine. This amino acid is naturally found in green tea. It is used for its relaxing and anti-anxiety effects. It is thought that L-theanine works for anxiety by increasing levels of GABA and serotonin. It is also used to improve cognitive performance, ADHD, and stress. Studies show it is safe and effective in improving depressive symptoms, anxiety, sleep disturbances, and cognitive impairment in patients with major depressive disorder. L-theanine calms you down without slowing you down. It promotes alpha brainwave activity, which is associated with a state of relaxed alertness, relaxing the mind without inducing drowsiness. It works fast, with its effects manifesting within 30 to 60 minutes. That makes it genuinely useful for situational anxiety, before a hard conversation, a presentation, or any high-stakes moment when you need to be sharp and steady at the same time. It appears to be well tolerated with minimal side effects. The research-supported dose is 100 to 200 milligrams. Many products are significantly underdosed, so look for a verified milligram dose and third-party testing. If this is useful, subscribe to the channel so you don't miss part 2. It covers a completely different group. You won't want to miss it. Now, before the 5th supplement, which is very interesting, you need to know about something that changes whether any of this actually works for you. The supplement industry in the United States is largely unregulated. That is not a criticism. That is just the fact. Unlike prescription medications, supplements don't have to prove they work before they hit the shelf. They don't have to prove the label matches what's in the bottle, and they don't have to prove they're free of contaminants. A landmark investigation published in a journal found that a significant percentage of herbal supplements either didn't contain the stated ingredients at the claimed level or contained substances not listed on the label at all. Here's an example. Ashwagandha is only effective when it contains a specific concentration of active compounds called withanolides. Pharmaceutical-grade forms like KSM-66 or Sensoril guarantee that concentration. Some supplements sold in stores may contain very little to no withanolides, rendering them essentially useless. Pharmaceutical grade means third-party tested, standardized to the active compound, and manufactured under certified quality controls. This is not a marketing term. It's a verifiable standard. And one more thing before we continue. Everything we're covering today works significantly better when your nervous system is getting real sleep. I built a free sleep guide specifically for people managing anxiety. Grab it in the description below. Number 5, Phosphatidylserine. This is a phospholipid, meaning a fat molecule that forms part of the membrane surrounding every brain cell you have. So it's not just a supplement, it's a structural component of your brain. And the research shows it blunts the cortisol response to stress and reduces cortisol spikes from both physical and psychological stress. It is used for age-related memory problems, depression, and exercise-induced stress. Adverse effects include nausea, stomach upset, and sleep problems. The typical dose of phosphatidylserine ranges from 100 to 800 milligrams daily. Most clinical studies use 300 to 400 milligrams daily for memory benefits and 400 to 800 milligrams daily for stress and cortisol reduction. I also want to mention one more supplement that didn't make my original list, but honestly deserves a spot in this conversation. Ginseng. This root has been used for over 2,000 years, and it's one of the top-selling herbs in the United States for good reason. Here's what makes it interesting for anxiety. Ginseng also works as an adaptogen, meaning it helps your body handle stress more efficiently. Its active compounds called ginsenosides interact with your GABA receptors, the same calming pathway that anti-anxiety medications target. It also appears to reduce wakefulness and support deeper, slow-wave sleep. The typical dose is 200 to 600 milligrams of extract daily. Some people notice a little nervousness or excitation earlier on, but that usually fades as your body adjusts. In part 2, I described 5 more supplements, including one that went head-to-head with prescription anxiety medication in clinical trials.